Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College. Dear students, welcome to you all today's pathology session. In our previous class, we have already discussed about the healing and the repair and about the granulation tissue. So, in this class, we are going to discuss about how the repair is occur. Repair by healing. Healing is a fibroproliferative responses that patches a tissue. It is a complex but orderly phenomenon involving a number of processes, which include at first induction of an inflammatory process in response to the initial injury with removal of damaged and dead tissue. Then proliferation and migration of parenchymal and the connective tissue cells. Number 3, formation of new blood vessels, that is called angiogenesis, and the granulation tissue. Number 4, there is a synthesis of extracellular matrix protein and collagen deposition. After that, there are tissue remodeling, wound contraction, and lastly acquisition of wound strength. These are the steps of repair by healing. What are the factors that influences healing? Actually, the healing is depend on the tissue environment and the extent of tissue damage. It also depends on the intensity and the duration of the stimulus, the condition that inhibit repair, like if there are presence of foreign body or inadequate blood supply, the healing may be delayed. There are also various diseases that also inhibit repair, like diabetes mellitus, and if a patient is treated with steroid, the healing is also delayed. Now come to our next topic, that is cutaneous wound healing. The skin wounds are classically described into healing by two categories. One is primary intention and another one is secondary intention. Healing by first intention or primary intention, it is the healing of a clear uninfected surgical incision approximated by surgical sutures. What about the criteria of primary union, or what are the criteria of healing by first intention? It includes if the lesion is minimally gap, that means minimal gap of wound, minimal tissue loss, minimal hemorrhage, absence of infection, absence of foreign body. These are the healing that occur by primary intention or first intention, and the example is surgical wound. Now come to the sequential step. What are the steps of primary intention or first intention? At first, the immediate change occur, which include the incisional spaces is filled with clotted blood, and there is a formation of scab over the surface to cover it. It happened immediately, and after that within 24 hours the neutrophils appear at the margin and infiltrate the clot. The epithelial cells move from the wound edges along the cut margin of the dermis, and the epithelial cell layers fuse into the midline beneath the surface of the scab. And in day 3, the neutrophils are largely replaced by macrophages. The granulation tissue progressively invades the incisional spaces. The collagen fibers appears and lie vertically, and the epithelial cell proliferation thickens and the epidermal layer. Then in day 5, the incisional spaces is filled with granulation tissue. There is abundant collagen fibrils bridges the incision. Neovascularization is maximum, and the epidermis recovers its normal thickness. After that, during the second week, there are continual accumulation of collagen and proliferation of fibroblast. The leukocytic infiltrate, edema and increased the vascularity have largely disappeared, and there is accumulation of collagen within the incisional space. And by the end of the first month, the scar is made up of a cellular connective tissue devoid of inflammatory infiltrate. The destroyed dermal appendages are permanently lost, and the tensile strength of the wound goes on increasing for months. These are the steps of healing by first intention or primary wound healing. Now, come to the healing by second intention or secondary healing. When there is more extensive loss of cells and tissue regeneration of parenchymal cells cannot completely restore the original architecture, then the secondary intention or secondary healing is occur, and abnormal granulation tissue grows in form the margin to the complete the repair. And this form of healing is referred to as healing by second intention or secondary healing. Now, what about the criteria of secondary healing? These wounds are lacerated wound, and the wound may have maximum gap. There is extensive tissue loss, also presence of profuse hemorrhage, presence of infection, and also presence of foreign body. And the examples are opened wound, abscess, ulcer, infarct, etc. Now, what about the sequence of secondary intention? At first, initial hemorrhage, hematoma formation, and then the acute inflammatory reaction at the margin of the wound, the epithelial cell proliferation and margination. After that, macrophage replace the neutrophils, and lastly there is granulation tissue formation and organization. After the granulation tissue formation, there are wound contraction. The wound may be reduces to 5 to 10% of the original size in week time. And the mechanism are, there is a formation of actin containing fibroblast at the edge of the wound, and the myofibroblast which is formed from the fibroblast by acquiring features of smooth muscle cell are responsible for the wound contraction. And at last there are formation of scar, and the scar formation and the thinning of the epidermis. These are the difference between the primary wound healing and the secondary wound healing. So we know that when the wound margin is gap is minimum, it is primary healing, and if the gap margin is maximum, the secondary wound healing is occur. Minimal tissue loss, primary wound healing. If the wound tissue is maximum loss, it is secondary healing. Minimal bleeding is primary healing, and more bleeding, that is secondary wound healing. If the exudation is minimum, the primary wound healing is happen, and if the exudation is marked, the secondary wound healing is occur. If the infection is present, the wound may be healed by secondary intention, and the granulation tissue is grossly evident in case of secondary wound healing, and the wound contraction is also present in secondary wound healing, and there the scar is large in case of secondary wound healing, and the scar is small in case of primary wound healing. So that's all about today's lecture, my dear student. Inshallah, see you again in our next class. Till then, Allah Hafiz.